mental health remains one of the world's biggest obstacles. We have been evolving as communities around the world, and despite the prevalence of inequality, it is undeniable that physical health has been improving. But the same can't necessarily be said about mental health. The growing complexities of the 21st century have been continuously adding extreme pressure on people from all walks of life. This has contributed to an uptick of people facing mental health challenges. Despite this, there hasn't been a proportional effort to provide mental health care to the variety of people who need it around the world. We want to start a conversation about mental health in the United States and India. It is often underestimated how many people struggle with their mental health. Many people think they are alone in their struggles, but that is far from the truth.
Mental health is not a ubiquitous experience, and each person's struggles are uniquely theirs, shaped by their personal lives and environments. When comparing the causes of mental health issues in the United States and India, there will be a significant overlapping, but also the prevalence of circumstances unique to each country. Many of the biggest contributors to the mental health struggles, like trauma, isolation, or poverty, are shared amongst both countries, but contributors like stigma or discrimination varies. It is also important to recognize that there isn't just a difference in how Americans experience mental health compared to Indians. There are many struggles unique to specific communities within each country. For example, marginalized communities in the United States might face similar challenges to those who are lower in the caste system, or women in each country might face varying degrees of misogyny based on factors such as wealth or race. Mental health care system in the United States and India have significantly different histories. There is a long and unfortunate history of ignoring those who are suffering from mental health problems or institutionalizing them in the United States. Recently, there has been more effort to take a different approach to mental health, but resources remain a problem despite a significant amount of money going to mental health care, and many areas don't have enough mental health professionals. While there are better approaches and resources in the 21st century, navigating the United States healthcare system remains complicated and pricey. Mental health has been similarly neglected in India, but India was one of the first countries in the developing world to adopt a mental health program modeled on the recommendations of the World Health Organization in 1982. There were many setbacks that contributed to the system's current underperformance, but stakeholders rekindled the efforts after calls for more actions against mental illness in 2011. India has since improved their mental health program and framed its first mental health policy, but there is still lots of room for progress because of similar issues regarding accessibility. There are a variety of problems that arise when looking to address mental health issues and provide mental health care. Some of the most prevalent reasons for a lack of understanding of the system, lack of motivation to seek out mental health care, financial struggles and time constraints, and lack of resources and providers near those in need. More than 60 million people deal with mental health in the U.S. Nearly half goes without treatment. Mostly in the U.S., people are not able to receive the treatment they need due to how costly it gets. Finding the right treatment and the time and effort it takes does take time. So most people tend to take care of their own issues on their own rather than seeking professional help. In both the United States and India, those who are lower on the socioeconomic ladder have a much harder time accessing mental health. There are more similarities between the access of upper-class Indian and Americans and lower-class Indians and Americans than there is between upper-class Indian and lower-class Indian, or upper-class Americans and lower-class Americans. One of the main barriers is ignorance of mental health. The people from minority communities in India, especially tribal people, do not recognize mental illness as a disease that needs to be treated by doctor or therapist. If they suffer from mental health, they do not go for further treatment because they do not consider it as a real illness. One of the biggest obstacles to mental health care outside of the systematics and financial issues are cultural and social stigmas. Many people are prevented from even attempting to seek help because of the multitude of stigmas around mental health care. While the stigmas vary from country to country, they are just as detrimental everywhere. In India, only about 7.3% of its 365 million youth even report their issues. Having these mental issues and just struggling are considered lack of self-discipline and willpower. In India, mental health is often considered as a stigma. People don't talk openly about it. One of the main reasons why people don't get therapy is judgment. A person who seeks therapy is considered as weak and mentally unstable. In some of the tribal communities, mental health problems are considered as madness. Due to such reasons, people with mental health problems are excluded.
Community health workers provide an amazing opportunity in the effort to alleviate stigma and provide mental health care. Here is what Andrew Linares from the Midnight Mission, a nonprofit organization in downtown Los Angeles, has to say about his work in the field of mental health.
Today,
there isn't one leading cause of mental health disorders for our homeless community. There are different categories of people on our streets who suffer from a mental health disorder. Many of the people on our streets don't start with mental health disorders. A few people may end up on the streets due to mental health disorders passed down through their genetics. I've met a handful of people who end up on the streets due to not having the proper medical care and medication because they cannot advocate for themselves. Sometimes families and friends leave them to fend for themselves. Other times, the individual runs away, feeling scared and uncertain about their surroundings. Most individuals in our streets who suffer from anxiety, depression, and bipolar disorder sometimes resort to drugs and alcohol to self-medicate because they are desperate to find something to relieve them. They cannot afford the attention and medication they need. Women, men, and others suffer from mental health disorders due to traumatic experiences, mainly sexual assault through a stranger or domestic partner. Many of these people resort to drugs and alcohol to self-medicate and escape the horrors they have experienced. Because of their newfound addiction, many of them experience the same trauma repeatedly, leading them to use more drugs and alcohol to escape the new trauma. Other men, women, and other groups of people are born with minimal to zero mental health disorders. Still, they begin to experience mental health disorders when introduced to drugs and/or alcohol. Each addict has their own story of why they started to use and where they got out of hand. Nonetheless, their use gets out of control and they begin to have mental health problems, such as depression, anxiety, attention deficit, obsessive compulsion, and post-traumatic stress. Many people on our streets start to abuse drugs and alcohol to self-medicate the traumatic experiences of physical and sexual assault. The struggles of living in the streets are too hard to live with, especially when you are a woman or a member of the LGBTQIA community.
what are some ways in which we as a society can help improve our understanding of mental health? Along with this, what can we do as a society to help those who struggle with some sort of mental illness?
One of the things that our unhoused community has mentioned is that they cannot find resources to help them without health insurance or that their health insurance could cover. More locations that can cater to folks without insurance or who can't afford their insurance provider need to be available. There need to be caring people who will meet them where they are. Some of our unhoused community needs more special treatment to be helped with the accountability and direction.
What have healthcare professionals been doing in order to create a safe environment for patients?
In Skid Row, we have a few healthcare providers working hard to meet everyone's needs, such as LA Christian Health Center, Joshua House, and JWCH. These organizations are trying to work with the residents of Skid Row, both housed and unhoused population, but they are limited through their resources. Unfortunately, the number of patients exceeds the number of medical professionals and available resources here in Skid Row.
How has the Midnight Mission adapted to help patients with mental health concerns during a pandemic? Has COVID-19 had an increasing impact on mental health?
The Midnight Mission has partnered itself with medical clinics here in Skid Row and with the Department of Mental Health to help individuals who require mental health assistance. LA Christian Health Center occupies a small space within the Midnight Mission, where they conduct essential services and help our community identify any leading issues. If the individual needs extra medical care, they are referred to their main office on Wall Street and 7th Street. During the COVID-19 pandemic, LACHC has helped us meet the people we serve where they are at and provide them with well-needed services.
What advice would you give to someone who is debating seeking help?
If someone is debating whether or not to seek medical help or trust anyone to receive medical assistance, they are welcome to contact our partner, the Los Angeles Christian Health Center. They have been the leading partner of the Midnight Mission, which has helped thousands of underprivileged members and can connect you to the resources you need. So, visit the clinic at the Midnight Mission or call 211 to find their nearest location to you.
Okay, thank you. Mental health remains one of the world's biggest obstacles, but there is a lot that can be done by raising awareness. There have been great stigma around it, and just now people are realizing how normal it is. We hope this video has been informative.